The brutal truth about healthcare burnout that nobody's talking about, and the escape route that lets you keep helping patients without sacrificing your mental health, family time, or income. Stay with me, because at the end, I'll share the exact steps I took to double my income while eliminating weekend shifts forever. Hey there, I'm career coach Rod, and if you're feeling trapped in bedside healthcare, I've been exactly where you are. When I worked at the bedside, I was pulling 12-hour shifts in med-surg, tele, ortho, and the ICU, missing family events and coming home so emotionally drained that I couldn't even enjoy my days off. Sound familiar? Here's the brutal truth about healthcare burnout that nobody wants to admit. It's not just about being tired or needing better self-care. The system itself is broken, and no amount of meditation apps or pizza parties are going to fix what's fundamentally wrong. But today, I want to talk about something different. Not just the problem, we all know that, but a solution that changed my life and could change yours too. Let's talk about digital health and why it's creating a lifeline for burnt-out clinicians who still care deeply about improving healthcare. Digital health is transforming healthcare in ways we've never seen before. Think telehealth platforms connecting patients in rural areas with specialists, AI algorithms detecting early signs of cancer, and apps that help patients better manage chronic conditions. And guess who these companies are desperately looking for? People like you and me, clinicians who understand the real-world challenges of healthcare. Here's what nobody tells you. Your years of clinical experience are actually your greatest asset in digital health. These companies are full of brilliant tech people who know exactly everything about coding, but nothing about what it's actually like to try documenting a patient encounter on a poorly designed EHR, explain complex medical information to a scared patient, or navigate the chaotic workflow of a busy hospital floor. Your clinical experience is gold in digital health, and they know it. That's why roles like clinical consultant, implementation specialist, and product manager often pay $20,000 to $40,000 more than bedside roles. Now let's talk about impact, because I know that's important to you. At the bedside, I might care for 5 to 10 patients per shift. Even over a decade, that's thousands of lives touched. Meaningful work that matters deeply. But in digital health, the scale changes dramatically. The patient portal I helped design is used by over 200,000 patients. The clinical decision support system that I consulted on helps thousands of clinicians make better treatment decisions every day. The telehealth platform I've worked on connects 75,000 patients with providers last year. My clinical expertise didn't go to waste. It got amplified. And I'm still using everything I learned at the bedside, just applying it differently to improve healthcare at a systems level. Let me share some quick stories of clinicians just like you who made this transition. Linda, a PT for 13 years, now works as a clinical analyst helping hospitals implement new technologies. She hasn't worked a weekend in years and increased her salary by 50%. One pharmacist who worked nights for years now designs medication management systems from home while being able to pick his kids up from school every day. One emergency nurse I worked with now leads the clinical team for a telehealth startup and says she's actually excited about going to work again. Now, I know what you're thinking. Do I need to learn to code? Will I need another degree? Am I even qualified? Let me address these concerns head on. You don't need to become a programmer. While some basic tech literacy helps you, your clinical expertise is what these companies really need. Most people don't need another degree. Many roles value your clinical background more than any additional education. You're more qualified than you think. The transition is smoother than you'd expect because you already understand problems these technologies are trying to solve. Let's talk about what this change means for your life. I work Monday to Friday, no weekends, no holidays. I sleep in my own bed every night, and I haven't missed a family gathering in years. I have the flexibility to attend school events. I still use my clinical knowledge every day. And yes, I make significantly more money than I did at the bedside. The most surprising part? I'm still helping patients, just in a different way. The technology I helped develop makes healthcare more accessible, more efficient, and safer for patients and clinicians alike. Now, if you've stayed with me this far, I promise to share the exact steps I took to double my income while eliminating weekend shifts forever. Here's my proven pathway that has helped dozens of clinicians transition to digital health. Start with the right mindset. Your clinical experience is valuable. Own it. Build your digital health network. Connect with others who've made the transition. Identify your transferable skills, clinical knowledge, problem solving, communication. Learn the basics. Familiarize yourself with digital health terminology and tools. Position yourself effectively. Craft your resume to highlight your unique clinical insights. The truth is, you don't have to choose between making a difference in healthcare and having a life. Digital health offers the rare opportunity to combine both. If you're ready to explore this path, I've created a free guide that goes deeper into each of these steps. Just drop an escape into the comments and I'll send you the link. Remember the same skills that made you a great clinician, empathy, problem solving, and dedication to improving lives, are exactly what will make you successful in digital health. Don't wait until burnout forces you out of healthcare completely. There's a better way to use your expertise, make an impact, and reclaim your life. Hit that subscribe button and notification bell if you want more content about transitioning from clinical care to digital health. And drop me a comment if you have questions about making this move. I personally respond to everyone. Thanks for watching, and I'll see you in the next video.